I'm here to see at first hand the evolving impact of the ongoing crisis on children and their family. So that means that I pay a visit and go around the country a little bit, so I was able to interact with children, with frontline workers, and also able to interact with the officials to understand their plans, their programs, and to understand the gaps that need to be prioritized now as the country deals with the big shock that the crisis brings. In the region, the South Asia region was heavily impacted by COVID, especially the Delta wave that swept through. There were long periods of lockdown. There was a big impact on the health of people. There was a big impact on the school system. The school system, for some countries, the schools were closed for 2 years, for some 18 months. For some, it was open and close, open and close. So we are seeing that these impacts play out now in strong ways. Families have less income. They've had a drop in their living standards and their ability to provide for their kids. We've seen a disruption to health services, especially immunization of children, because that protects them against diseases that can kill them. So a drop in that is a serious matter for us. We've seen in some places increases in malnutrition, and we've seen a major loss in terms of learning. So all over the region, these issues are prevalent. The last one is in the area of mental health, and there are some countries in the region that are among the top 5 when it comes to mental health of young people globally. So we've seen a rise in the number of cases, for example, of suicides in some countries of the region. And as UNICEF, these are areas that we are particularly engaged with governments, with partners to address. Indeed, UNICEF has already started providing assistance in terms of medical supplies to Sri Lanka. In partnership with the government of Japan, and I'd like to acknowledge the government of Japan on this. They partner with us to start bringing in essential medicines and health supplies. The first batch has already arrived, has been distributed. We're expecting another batch to come. This is an important issue to keep the health system going, and we know that in the larger scheme of things, more investments will have to go into it. And we know that the investments have to be done in a timely way, because the world is experiencing supply chain issues. So if you don't pre-order now, it will take a longer time, and for issues regarding health, it must be timely. So it's an area that we are paying close attention to. Children are always disproportionately affected by crisis. It's by virtue of their age and then needing assistance to be able to cope. So where assistance is not forthcoming from the family or the government or from communities, children bear that brunt. And by virtue of their age, they're not able to work, engage in a way that draws attention. Even if they can advocate, they need others to speak on their behalf as well. So we are seeing the crisis again impact on them in various ways. So there's a food crisis in the country. For adults, it might be just in terms of hunger. For a child, it's in terms of malnutrition. It's in terms of the child becoming wasted, or it's in terms of the child becoming stunted. So the impact is a developmental one. It's a long-lasting one. Adults have had the privilege of going through those phases already. So the impacts are not the same. For a child, it's a long-lasting one. For a child, impact on education means the loss of opportunity to learn, and then you grow up with it. Then it becomes a long-lasting one. We are seeing, and I saw at first hand how this is playing out in the family budget. So they are eating less, and they are eating less quality food. So if it's 3 times a day, now you eat 2 or once. And what you eat compromises nutrition. So you end up eating largely carbohydrates, and you lack protein, you lack some of the micronutrients that one needs. And if you're a child, this becomes vital for your growth and development. And adults, we've gone through it, but for a child, it becomes vital. So it is essential that the government, the international community prioritize investments in these areas, in nutrition, in education, in health, because these have long-lasting impacts on the development of a child into adulthood, and this has direct impacts on the growth of the economy and of the development of society. At times it doesn't appear apparent because you think it's just a child, but in terms of the long-lasting impacts, it can be very severe. And what one should avoid is a generation of children that lack the ability to contribute meaningfully to the growth of society, and that can be prevented by acting now.